Good day everyone, I am Cris Antonette Suacito, BSN 2K, a nursing student from Iloilo Doctors College. So today I am going to do my return demonstration with regards in the assisting of the insertion of intravenous infusion. The first thing that we need to do is to introduce ourselves to the client and verify our client. Hi, I am your nursing student for today. I am Cris Antonette Suacito. May I know your name? Okay, may I see your armband? Okay, thank you. So, sir, I am going to assist you with regards to your fluid losses and to relieve your dehydration through intravenous infusion, sir. So, I am going to insert you a cannula. In this way, we can attach our intravenous infusion, sir. So, this is through your vein. Will that be okay, sir?
Yes.
So let's make sure that our client's clothing or gown can be removed over the IV apparatus if necessary. Let's gather our equipment and bring it to the bedside. And then next, we're going to perform our hand hygiene. Next is I am going to open and prepare the infusion set. First, I am going to remove the tubings from the container and I am going to straighten it out. Okay, so next I am going to slide the tubing clamp along the tubing until it is just under the drip chamber or below the drip chamber. Then we're going to close the clamp. We're going to leave the tubings closed with the plastic cups, this one, until the infusion has started. Now is we're going to spike the solution container. Next, we're going to remove the cup from the entry side of the bag. And then we're going to enter the spike into the insertion site. So we're going to apply a medication label if a medication was added. Next is I am going to hang the container on the pole. And we're going to adjust the pole about 1 meter or 3 feet above the client's head. Let's partially fill the drip chamber with solution by squeezing the chamber gently until it is half full of solution. Now we're going to prime our tubing. Upon priming the tubing, we're going to remove the protective cup and hold the tubing over a container. So this is the container, and then let's maintain the sterility of the end of the tubing and the cap. And then we're going to release the clamp and let the fluid run through the tubing until all the bubbles are removed. So now we're going to clamp the tubing and replace the tubing cap and maintain the sterile technique. Next is we're going to select our venipuncture site. Place a towel or a bed protector under the extremity to protect the linens. So we're going to use the non-dominant hand of our client unless contraindicated. After selecting the venipuncture site, let's clean it with a topical aseptic technique, and then we're going to use a circular motion, moving from the center outward for the several inches, and then we're going to permit the solution to dry on the skin. So this is the vein that we're going to puncture. So we're going to insert now. Let's remove the needle, then insert full of it. And then we're going to engage the needle safety device and attach the end of the infusion tubing to the catheter hub. And then we're going to dress and label the venipuncture site and tubing according to the agency policy. So we're going to apply sterile transparent occlusive dressing, and then we're going to tape the catheter by the U method. And then we're going to apply the padded arm board to splint the joint as needed. Next is we're going to loop the tubing and we're going to secure it with tape. Next is we're going to adjust our infusion rate of flow according to the order. Next is we're going to remove our gloves, and then we're going to dispose it appropriately. Next that we're going to do is we're going to label and dressing with the date and time of insertion and the gauge of needle or catheter used and our initial. And then we're going to label the tubing with the date and time of attachment and our initials also. Lastly is we're going to document our relevant data, including the date and time of venipuncture, the time of the start of the infusion, and the flow rate of the infusion, as well as the amount and type of the solution used and any additives, as well as the type and gauge of needle or catheter, and then the venipuncture site, and as well as the client's response. So, sir, thank you for your cooperation.
You're welcome, Miss.